It's a one-of-a-kind team providing palliative care to people experiencing homelessness here in the Greater Toronto area. And the tailored supports given to this population who oftentimes feels forgotten go beyond just their medical needs.
Like, he didn't want respite, he wanted to get better. They were saying, you can't get better, you're terminal.
Words no mother would ever want to hear about her son, who has been experiencing homelessness for decades and struggling with health issues, including an HIV diagnosis, when suddenly the hospital says nothing more can be done.
That, I thought, they're not trying to kill you, they're just willing to let you die. And this is a fact, because he's still alive.
For that, Jamie's mom credits a small team that goes by the name of PEACH, which stands for Palliative Education and Care for the Homeless.
I begged people to help Jamie, and then I got in touch with the PEACH team. They heard my plea, they came to my aid.
This is what many call the Peach Mobile. We're riding in it right now, we're rolling, and so, you know, a typical day.
The mobile team, funded by the Inner City Health Associates, traveling by car, transit, foot, and bike, spends hours on the road treating patients experiencing homelessness, meeting them where they're at, parks, shelters, rooming houses, and on the street, to deliver what they say is trauma-informed, compassionate care.
There are, you know, lots of instances where, you know, we come in and, yeah, we've, you know, done the right things technically, medically, but it doesn't matter because the person doesn't trust us because they've been traumatized by the healthcare system in the past.
The PEACH team is comprised of palliative care doctors, nurses, a psychiatrist, social worker, and a health navigator.
And I'm just carrying around all kinds of stuff all the time. Like, we have some Ensure in here, we have donations of clothing. I mean, like, we have everything, and we're mobile, so we need to have this stuff here. I mean, clothing, tons and tons of clothing. Diapers, if you need it. I mean,
not only providing medical supports, but addressing health inequities that prevent patients from accessing care and services, and bridging gaps to provide basic necessities.
Palliative care is not just the prescribing of medications. It's also putting in place the supports that the person may need, usually that relate to the social determinants of health. Housing and income, food security, transportation. These are social factors that play a role in determining the health status of an individual.
Recognizing that these factors can impact or transform the lives of patients that have faced systemic barriers in accessing even the basics, particularly during a vulnerable period in their lives.
They all of a sudden can really turn around. They can actually improve. And I think in the case of Jamie, you can see how good palliative care, which is really just a good approach to care that recognizes, you know, a person's humanity, they thrive, and people can and outlive their prognosis.
A turning point for Jamie, finally securing housing at an HIV specialty hospital through the PEACH program. And suddenly, his prognosis changes.
They got food for him, they got people to come. They tracked down his old doctor. But when they say frontline, the PEACH team is frontline.